So, hello. What we're going to do today is we're going to talk about muscles. And what I want to do is I want to go through the muscles on the term list number 1 and just talk about those on the term list because you've already watched videos and you've done the quizzes. Are the quizzes useful for you guys? Anyone?
Yes.
Yeah, they're okay.
Mm-hmm.
Good. So yeah, so the quizzes are a little bit more detailed, and then the labeling exercises is fairly detailed as it comes to the muscle, as you can see. But when it comes to the test, what I want you guys to be doing is being able to identify when I label a muscle. Identify when we do a muscle, but also when we do a bone. So let me actually briefly go through what the test looks like in terms of that identification. We should have not that up there. I should have this Word document up here. Sorry about that. That should have been uploaded. Let's hope it goes in now. There it is. So when you come to the test, when it comes to bones, I either ask you for a full bone, like if you look at the term list 1 on the first column, you see that the first term says frontal bone. So I'm either asking for the whole bone here, which is the frontal bone, or I'm asking for a landmark on that bone. And if I ask for a landmark, let's say I have a landmark right in here between the eyebrows, then it will be called the glabella. But if I ask for a bone and I have a tag somewhere in here, it will be the whole bone, and that will be the frontal bone. And then as it comes to muscles, I'm just simply gonna point to muscles and ask you, what is this muscle called? And I'm not gonna ask you for, if it's for, I might ask here, what is this muscle called? And you tell me it's the Rectus Abdominis muscle. You look it up on the list. So only terms on the list are testable. There are no other terms that are on the test. And in part, I want to make sure that that's when you differentiate muscle on the forearm. We're going to go through that today. It gets a little tricky if you have too many muscles that can be part of it. So that's why I want to do that as well. So let's go and talk about the axial skeleton. So let's see if you can see can you see my PowerPoints?
Yes.
Good. All right, so we'll have the PowerPoint here. We'll make this a little bigger. There we go. That's good. That's all right? Size-wise, it's okay?
Yeah.
Thank you. Thank you for being responsive. I know it's a little weird. So yeah, if you have a question, just interrupt me. So for the most part, I've just kind of talk through it, but that way it doesn't have too many pauses. But if you have a question, just stop me and say, oh, I got a question to this. Don't feel like you have to hold up your hand or anything. That's a little different than in the classroom. So when I look at the first muscle that is on that list, on the third column under muscles, first we have the facial muscles, and then afterwards it's the upper extremity muscles, and we have there the trapezius. And the trapezius is a big muscle in the back, superficially in the back of the upper back down to the middle back, down to T12 more or less. And it is on the spine of the scapula and the clavicle, and then it goes onto the spinous processes in the middle of the spine there. And it helps to do a bunch of motions with the neck. If you visualize what you want to do with muscles, you want to visualize when they contract, what motion would that do? And so if you can see here, these fibers go from all the way the occiput, actually, the EOP actually, which we've learned that, down to the T12, but then they reach downward into the shoulder blade area, and when those muscles contract, you can visualize how the neck would fall backwards, and you go have extension of the neck. We can also visualize if both sides contract. Here on this side, you don't see it because it's taken away. So you see the muscles underneath it, but it would be here overlaying as well. So you also have it on both sides. And so if they both contract, then you get the extension. If one side only contracts, you're going to get the neck go to the side. So that will be side tilting to the same side. Or also the way that the fibers are arranged, when we pull on these things, we can rotate the head and the neck away from the side that's contracting. So it just depends on which muscle part we contract on that trapezius. But what you generally can visualize, and what you get better at it as you visualize it or try to create the motion in your own body when you study these muscle things. So because the muscle only does one thing, it contracts, it shortens, and that's how it executes motions. So for the test, you have a muscle a muscle like that would be the trapezius. Then the next one that I think is fantastic of a muscle is the sternocleidomastoid muscle. And the sternocleidomastoid is attached to the skull here behind the ear on the mastoid process, and it goes forward onto the sternum, the breastbone, and a little bit of the clavicle as well. You can see it here pretty well. And so that's that name is the first muscle's name, the trapezius, is by its shape. This muscle's name is by its attachments to the bone. So you usually have some kind of a reason why a muscle is called something. And so this is the bony attachments. The sternum, the cleido is clavicle, and mastoid is a mastoid process. And so when that muscle contracts, it tilts the head to the same side and it rotates the head. I always have to look that one up. It also extends the head, which is kind of weird. And I always think, oh my God, I made a mistake here. And I even just wrote it down. But if you think about it, the fulcrum of where the head rotates is right underneath, or where the head tilts back and forth is right under here under the ear. And if that muscle is attached behind the ear, and if that is then contracting, it sort of pulls that head over the fulcrum, and that will extend the head backwards. So that's kind of an interesting motion, but it is the correct motion. So that's the sternocleidomastoid in the front. So it's a very superficial muscle. You can see it on people. You can see it sticking out right in here. Underneath that one, we have the scalene muscles, and you see those right in here. And the scalene muscles are on the side of your neck. And if you actually take your hand and you go onto the side of the neck, and you oppose that motion of rotation, you can see how it sticks out here. So you can actually feel, when you resist the motion of a muscle, you can feel the muscle bulging out, and that shows you where the muscle is. When it does the motion, it's a little harder to do that because you're actually moving your body around. So it's harder to pinpoint it. And so right here is the sternocleidomastoid, and next to it next to and below it is the scalene muscle. So you can, if you feel the sternocleidomastoid, you can kind of feel next to it on the right side, or on the side laterally, you feel those tender spots in here, and that's the scalene muscles in there. So people get then, if they're really tight in here, they have problems with the ribs, with holding up their arms all the time. And that can create arm pain into the hands and create tingling and numbness in the hands as well. And so that's a very interesting muscle, the scalene muscles. And so that's one reason why I put this here, this yellow stuff is nerve. It's the brachial plexus that goes through those muscles. And then if these are really, really tight, it can pinch those nerves a little bit and can give you tingling and numbness in the hand. So that's why this muscle is very important to me. A lot of those problems can come from it. All right, then let's go to the next one. We jump over a few. We jump over the deep front muscle, the longus colli, and the longus capitis on top. And we also jump over the deep muscles in the back of the head. We have a few layers. We have this superficial caught one, that's the trapezius. And then you got deeper ones that are also caught here. And those are also not on your list, but we have them, I think, on our homework. They are semispinalis and the spinalis muscle. So they're a fairly deep layer of muscle that just kind of goes, one goes a little bit from the outside towards the more midline, or it's just basically straight up if you really think about it. And the other one goes a little bit more lateral from the midline outwards to the mastoid, the posterior part of the mastoid process here of the skull. So those are deep muscles, and when we take that layer away, then very deep inside the neck, we have on the upper neck, right underneath the occiput, we have these small ones, the rectus capitis minor and major, and the obliques muscles. So these go like this way. The rectus, they help the neck go backwards, and then the obliques muscle one is on the sides to the first vertebra, and then the other one is on the bottom here. So they make what we call the suboccipital triangle. This is the suboccipital triangle here. So these are interesting clinically, and I want you just to be exposed to them. So when they come back to haunt you, you have them somewhere labeled in a place where you hopefully have sort of an overview of them. And they are important. It's just too many muscles for a test. The next ones are the superficial ones in the back, the erector spinae muscle. And those are the ones that you can see it right here. They're bulging out on this guy here. You see this here is the trapezius up here. So you kind of see that. It's a little bit bumpy. It's a bumpy ride there. Then we got down in here, that will be the Latissimus Dorsi, and we'll talk about that later. But these going up and down on the side of the spine, those are known as the erector spinae muscle. And they are made of multiple different muscles. As you can see, there's a lot of different attachments everywhere. And so we have the iliacus, longissimus, and spinalis. The way I remember that for a class later on, maybe if you need to remember these muscles for longer terms, ilio is the ilium, is the hip bone, this part of the hip, and costalis means rib. So they go from the ilium to the rib. So these are the most lateral ones. And then the longissimus goes from, it's the long one. I just remember because it is long. Longissimus is a long one, goes sort of from the midline upward, a little bit less lateral, more towards the midline a little than the iliacostalis. And then the spinalis, that's the one I remember easier again, because that's right on top of the spine. It's right by the spinous process, medially located. But you don't need to differentiate those. You just write down erector spinae muscles. And then from there, we go into the breathers. But I put this multifidus muscle here because many of us have back pain at some point in their lives. And very often when we have back pain, this deep, deep, deep muscle that is not the erector spinae. See here, these are the erector spinae. No, these are the erector spinae. And then these here, the quadratus lumborum, and the deep ones are the multifidei muscles. And so they are like going from transverse process to spinous process. So they are like on the spine. Multi means many. They have many little heads. Fidus means head. And they contract every little segment and make sure you have stability in the spine. And so that muscle is one that weakens if we had back pain. So you can see here's a cross of a MRI coronal section. We see this is black. So this is the hip here. This is the hip. So it's cutting right through you. And you see this is black. This means it's muscle tissue. And that means it's strong. This here is white. This is fat tissue. Not like fat, like we're fat. More like inside, instead of muscle tissue, the body makes adipose tissue because it's cheaper to make and not maintain. And so this back here is not protected well as it comes to different motions that creates pain. This is very well protected up here. And we have shown that if you had pain in the past, this muscle turns off neurologically. And so it's important to know about that, because you can make exercises like do the Superman, they call this the Superman exercises, where you extend the trunk somehow and create some space or contract that muscle. And that way you get stronger in there. So that's why I put that in there. So there you go. You already have a little bit of something. You can help yourself or some other people. And then we're going to go to the breathing muscles after that. And when we look at the breathing muscles, we have some on the ribs. When we look at breathing, what you do is you move the rib cage, and then the lungs are attached to the rib cage, and they move with the rib cage. And so we'll talk about that lung suction to the rib cage when we get to the respiratory system. But for here, we talk about the muscles that move the rib cage around. And so the muscles, every muscle that's basically attached to the rib cage is going to have a capacity to help with breathing in some fashion, if you just think about it. But mostly we have principal muscles that are mostly doing the work, and then accessory muscles that are doing the work once we are really active and we run around like crazy, or we need to bring more volume into the lungs, and we need to stretch that rib cage as much as possible. So the principal breathing muscles and inhalation muscles are the ones that make the rib cage bigger. And they are the external intercostals on the ribs here. And so you see these are on the outside right here. They're attached to the ribs below and the rib above. And when they contract, they bring that lower rib up and expand that rib cage that way. Then we have another muscle that is really powerful in breathing, and that muscle is known as the diaphragm. And when we look at the diaphragm, let me go to the next slide for that. This is a really good picture because you see how the diaphragm is going up from the edge of the rib cage into the lung tissue, halfway up practically. And we call that the parachute muscle because of that, or it's like a parachute shape. We actually don't call it the parachute. I just made that up. But it is like a parachute. So that helps me remember how it works, because what happens is we can look at it from below and we see this tendon here. So the muscle is attached on the outside, on the rim of the rib cage, all the way around, and also the spine. It moves over to the spine and then goes around the spine. And then it has a tendon, a white thing that in its inside. So like underneath it. And so when it contracts, it pulls that whole thing down, and it pulls the lungs down with it because the lungs are attached to it. And so that, of course, you can imagine how powerful that is as a breathing muscle. And so that's actually why we want to do belly breathing when we are neutral. We don't just want to breathe with our chest. If you just breathe with our chest, we have neurologically creates a little bit more of a sympathetic response, a little bit of a fight or flight, a little nervousy, a little more anxiety. When we breathe with our belly, and we can train that by having a book or so on our belly and see it go up and down, so we can train how that feels when the diaphragm is actually engaged. We don't just do chest breathing, because we're told to keep our stomach in, right? And keep the stomach strong. And so it's harder to breathe with the diaphragm fully when we don't allow our stomach to go out. And so, you know, that's kind of a little bit of a problem. But it's much better for us because it brings more oxygen into the tissue, and more oxygen in the tissue helps the tissue, you know, live better and make more energy. So that's the diaphragm. And so those are active breathing inhalation muscle. And then we got one that is an exhalation muscle that we talk about. Well, when we have quiet breathing, which is like we're just sitting there, we don't do much, then we don't really use that exhalation muscle, because we just kind of like have a recoil of the lungs. The rib cage is not the dip cage here. Look at that. There's a spelling error. The rib cage has elasticity to it, and it can recoil. And so that's the exhalation. But we can forcefully push the air out a little bit more. And the first muscle that engages in that is the internal intercostal, because that's attached, right? You can see it on, you can kind of see it. No, they indicate it right here. I'll show you where I tag it on the test. That way we can see that on the model. But that muscle is attached on the bottom here and on the top, and when it contracts, it pulls down the upper rib and makes that rib cage a little bit smaller. We also have other ones. We have the abdominal muscles that can help compress the rib cage, and so forth as well. So these are when we actively exhale muscles. So again, everything that's attached to the rib cage will be able in doing that and help that. But for the test, you only need to be able to label it. So let me actually do that real quick and go and show you while we're doing that where I label those for the test. And you have this document. Did everybody find this document with these pictures? Did you look for it?
No, I didn't even look for it.
Good. Well, if you want to look for it, then, and thanks for being honest about that. If you want to look for it, that way I can point it out again, because this test is coming up. And we might have to go a little longer than Sunday, but don't tell anybody.
So it's in the modules though?
It's in the model. See here, test 2?
Yeah.
FYI.
Oh, I did look at that, but I didn't see any pictures. I just saw a bunch of videos.
Oh, there's videos, and then there is the pictures used on test 2.
Okay.
And that's a PDF of that. And because I used those, well, when I made it, it was just when COVID started. So I went to school to take all these pictures and videos. And so I don't have all of them like without labels on them, but whatever I had, I put in a document to, so you can sort of study also with, you know, with them, or these are also the models that I show in the videos, and so it maybe gets a little bit clearer what I need or what I need. So when we come down here on the chest, when I tag the intercostals, can this go a little bigger? There you go. Can you see that chest here, right here?
Yeah.
See this here is the external intercostals, and then right here is a little sliver. That's the internal intercostal. So that's kind of one of the meanest one here, I think. If I label that, it's just so different without being in a classroom. But this here is the external intercostal, and this is the internal intercostal. That's why if you talk to other people, if they are not able to be on the class, they should listen to the video. And I'm actually not monitoring how many are listening to the video, because you do have an advantage for the test if you're part of the video. All right, so that's this part. So let's keep going on the PowerPoint. So we did the diaphragm, we did the breathing muscles. Cover moving slow here. Let's keep moving a little bit faster. All right, we then get to the abdominal muscles. And the abdominal muscles are numerous layers. We have like 4 layers or 5 layers of that thing. No, 4 layers that we worry about. We have the top layer here. That's the rectus abdominis. And that's the muscle that, you know, is that 6-pack muscle, although it's actually an 8-pack if you really work it right. But it's there's muscles the most superficial that has tendinous inscriptions in it, they call these. And actually what's interesting, the muscle is very powerful because it acts like 4 different muscles. So that the first one goes from the pubic bone to the belly button, and then we separate the latter ones into different sections. And that muscle and many of the muscles are medially attached to what's known as the linea alba right in here. And so the linea alba is a thick fibrous connective tissue, CT's connective tissue, that goes from the xiphoid to the pubic symphysis. Goes all the way down. So, and a lot of these muscles can anchor into that thing. So we have then a few muscles. So we have the rectus abdominis on top, and then we have on the side, we have muscles that come from the outside inward a little bit. And those are the external abdominal obliques. And then we have a deeper layer, and that goes the opposite direction, sort of from the inside more down and outward or backwards. And so you can see them here, how they're separated out. The externals go sort of from the outside towards the midline, and they go a little down obliquely. And so I always visualize that they go in the direction of like you're putting your hand in a pocket. And so that's the fiber direction, because when you look at muscles and you have to figure out which muscle is which on a model, or actually even when you work on it, you can feel the fibers or you can see the fibers. And that's sort of what you often can use as clues which muscle it is. So the external abdominal oblique muscle has fibers that go from the outside inward and forward. And the internal abdominal oblique muscle fibers go more backwards, as in oblique direction, from the front towards the back. And of course, they're also attached here, but they still have that direction in it. And so then, so that's those two, external, internal abdominal oblique. And then I have the transverse abdominis, and the transverse abdominis is a muscle that goes around the stomach. It's actually not as thick as this. It's pretty skinny. It's like right in here, transverse abdominis, the most inward one. But the thing with that is it's our core muscle. So it keeps this section here, this trunk section, really stiff when we do sports, for example. And you probably heard of core. The reason why core is important, and this is a great way you can create core, or you can do burpees or something like that, is if this is really solid and compressed abdominal content, which is kind of a fluid thing. Abdominal stuff is fluidy. Lung stuff is more airy. And so it's hard. You can't contract that. You got to breathe. Otherwise, you're not going to breathe. But if you have this be very solid, the appendages, the arms and the legs that are attached to this solid trunk can move much more controlled and not wobbly. And so, and if this is not solid, if this is wobbly and moves all over the place, when you move your legs and your arms, they are also moving much more wobbly, and that wobbliness creates more injury. And so you can see if somebody like, runs and it's just everything moves, their core is not that great. That's more of a potential for injury than if you're like keeping the stomach walls tight at that time when you do exercise, and then that creates a strong core. Anyway, that's why they talk about core. So I thought I'll just give you that little clinical thing, because it took me a long time to understand why is core important. And so when I finally got to massage chiro school, I kind of got it. Anywho, that's the trunk muscles right here, the axial skeleton. So if there are no questions, we can go right to the upper extremities. Can you see my upper extremities here? Yeah? No? Uh-oh.
Yes.
Oh, good. All right. I should have just, if no, say something. When I look at the arms and the legs, I'm looking at a few muscle groups, because then it becomes a little bit more understandable for me to learn it. And also clinically, I mean, I work on this stuff every day, and I get these patients coming in with, shoulder problems, and they couldn't figure it out or whatever. And then I have to look at, I look at the joints that are involved, and like, is this clavicle a little high? Is this arm a little forward? Or is actually often the rib cage is a little bit backwards on one side because somehow they yanked on an arm, or they had somebody ran into their shoulder or so. I mean, think of football, or I don't know what you guys play. It's a lot of contact sports can do a lot of things. And then I go into the muscles, and I look at the muscles from my perspective. If I find something is in the shoulder, let's say, I look at muscles that hold the arm into the shoulder blade, and then I look at muscles that anchor the shoulder blade onto the trunk. And then I look at muscles that move the shoulder around and the elbow around, kind of thing. But so I look at groupings of muscles, and I think it's very helpful to study them that way too. So the first group I look at are the muscles that hold the shoulder blade into the chest. Because when you look at the whole shoulder, this is incredible. It's very flexible, the shoulder. You can do all kind of motions with this thing, and you take it for granted. But it is very vulnerable through that process. But it's actually extremely strong when you look at what it can do and how strong it is and how little vulnerable it is. If you have a crane like that, it would not work. But you have these muscles that have to hold the whole shoulder blade into the chest, because the only place where you have a joint to the axial skeletal, to the trunk, is right here in the front of your clavicle. And that's not really a strong joint. That thing basically holds the whole shoulder blade back. That's a very weak bone. And so most of what goes, how the upper extremity is anchored to the chest, is done by muscles. And so we have a few. We have we look at this side here. Well, let's look at the back first. It's a little easier. We have in the back, we have a few that go from the border here of the shoulder blade up to the neck, and the upper neck, and then a little the lower neck, and then the mid back a little bit, or the upper back there. And so those are known as the levator scapulae, is the one that goes from the upper portion of the shoulder blade, the scapula, up into the neck. and it lifts that shoulder blade up. That's why it's known as levator scapula. It elevates the scapula. And this is actually, I call this kind of my boss is mad at me muscle, because when people walk around like with their shoulder up their neck because somebody gave them some bad whatever, that muscle is usually excessively tight on them. So is the trapezius too, of course, which is this one over here. It's overlaying the levator scapula. And then the rhomboids are lower down underneath them, and those are known as the rhomboids. They call them rhomboids because they look like a geometric rhombus, which is a figure, a geometric figure right here. So that's the rhomboid. So that's the back. And then we will have some muscles now that come and anchor the front. And so we have this picture up here where we see we have one muscle that comes from the front part of the shoulder blade. This is the coracoid process here, the coracoid, and it goes into the chest wall, into the ribs right in here. So that's the pectoralis minor muscle. That's a anchorer of the shoulder blade as well. And then the last one is actually the first one on your list, the serratus anterior. And that is interesting. That is attached right underneath here on the other side of the shoulder blade that goes towards the chest, and it wraps around the chest and comes into the front. And it looks like these little fingers that come down. You can see it on boxer people. Let me see if I have a picture of that thing. See this guy here. Ooh, little, I don't know, a little much for me to do that, but you know, this guy here, you see these little things come in, these fingers, that's the serratus anterior. You see it on boxers really strongly because the boxers need to make sure the shoulder blade is really strongly held towards the rib cage, so when they box, that doesn't just fall backwards. And so that's why that muscle is really strong in boxers. So so that then holds the shoulder blade towards the chest. So that gives us all these four muscles here that we want to study. That's pretty much the main thing that we worry about, that holds the shoulder blade into the chest. When I clinically works, I don't work on more than those in that area. And then what we do after that, we go to the muscles that hold the arm into the shoulder blade. So I call it the muscles we just talked about. They anchor the shoulder blade to the rib cage, and then the muscles now, these rotator cuff muscles, they hold the arm into the shoulder blade. And so they're all attached on the shoulder blade. So there's four of them. There's one on top of the spine of the scapula and the supraspinous fossa. Guess what? They call it the supraspinatus. How convenient is that? That's why you want to learn those landmarks. And then we have the infraspinatus in the infraspinous fossa right here. So that should be also helpful to learn that way. And then when we flip the scapula over and go towards the ribs, we have the subscapularis muscle, and that's in the subscapular fossa, and that's right underneath here, and that's a meat right in there. And so that's also why I think I make you study the subscapular fossa. I don't even remember. Yes, you have to study that. All right, and then when we flip it back, so we look at the back side again, we have one more sliver of muscle that we sort of look at independently, and that's the Teres Minor muscle right in here. Teres Minor muscle right in here. I'm not so sure why they separated. Yeah, I'm not so exactly sure why they separated from it, but it's a different neurology and it's a little bit of a different attachment. So that's why they do it. So then that anchors our arm into the chest. And let's look at these real quick on the models. Let's see if we find some model pictures of that stuff. So we can see we can see the sternocleidomastoid here. We talked about that in the trunk. We can see the trapezius here going upwards. We can see the scalenes here on the side. We saw that in the trunk. Is this big enough? Here it's bigger. SCM, scalenes, and then the trapezius. We do that. And then on there, we have a hard time seeing the pectoralis minor is not visible on this model. And so I actually don't have that. So you can actually cross that out, kind of. Oopsies. And I also don't see the levator scapula on it. I see the serratus anterior. If I look at the serratus, see these things coming into the ribs here, these fingers? This is the serratus anterior. So if I have to label that, I'm going to go right here in that. And then I do have, and I did not take a picture of the back, but in the back you can see the rhomboids. But those are fairly simple. They go from the inside of the scapula upward. You can see that. And then here we have all the sits muscles. We got the supraspinatus on top, the infraspinatus below here, and then the teres minor. You see it how it's a little separate, a little different. So that's the teres minor. Below here is the teres major, and we might as well just go to that. So that's the teres major here. That's the teres minor. The teres minor goes to, let me see if I took that off. No, I didn't take the deltoid off. The teres minor goes to the tip of the shoulder, the arm here, the tubercle. The greater tubercle. The teres major goes into the further down on the arm, and so it actually is a muscle that moves the arm. And so we have that muscle, and now let's go back to the slideshow. We can see that on here. We have that muscle, which is right here, the teres major, which goes into the arm on this side. See, the minor goes right to the greater tubercle where all the other muscles go to here. And then we have the teres major underneath it. And that works actually together with this big muscle here. And that big muscle is the Latissimus Dorsi. And so now we're moving into muscles that move the arm around. So the Latissimus Dorsi moves the arm back. Like if you're swimming and you're doing crawling, that moves the arm backwards. And that's the Latissimus Dorsi. So that's in the back side there. You can see it on this side as well. And then on the outside of the shoulder, we have a muscle called the deltoid. And the deltoid moves the arm upward and a little forward, a little backwards, because it's got all these fibers. It's actually attached where the trapezius is attached on the other side of the spine of the scapula. So it's kind of interesting. And then also on the clavicle, it just reaches down. So there must be there's some connection here, how these work together through that process, of course, right? So that's the deltoid, the Latissimus Dorsi. We have the teres major. And now when we flip the person over to the front, we got the big muscle overlying what we had underneath, which was the pec minor. Now we have the pectoralis major muscle right here. It's a different function than the pectoralis minor, but it's just they are close together. So, you know, they have the same name because of that. But the pec major goes in the arm around here, and then it brings the arm forward. So forward and downward. So the latissimus brings it downward and backwards, and the pec downward and forward. Or also medial, across. So that's that. And then the last one here we have is the coracobrachialis. And the coracobrachialis is attached to the coracoid process and goes into the brachium, into the upper arm. And that helps raise the arm up a little bit in that motion. And so then that feeds into muscles that move the elbow around from there. And some of them do a little bit more than just the elbow. And so we have the first one there, it's the biceps brachii. And that muscle helps because it's attached to the shoulder blade. So it helps, and it goes all the way over the elbow joint. And so that's interesting to see it where a muscle crosses two joints. A muscle usually crosses, most of the muscles cross one joint, because we got a fair amount of them that do cross two joints. They have multiple different functions on multiple different joints. So as the biceps brachii brings the elbow closer and flexes the elbow, it can also work up here and bring the shoulder up and extend the shoulder, flex the shoulder upward. So it can also do that. And then actually it has a third function as we get to the forearm. It actually also helps when you bring the palm down. What happens in the forearm, your arm bone crossover. So you have the ulna and the radius crossover, and then you need to uncross those back to straighten bring the palm back upward. So to supinate the palm, you need to have a muscle that's attached. You actually have a couple muscles, but we'll talk about this one for that function. You have a muscle that's attached here at the radial tubercle, and then when it contracts, it turns it around and flips it back to the other side, so they're parallel again. And that's why the head of the radius is round like that, because it wants to have that ability to use this as a fulcrum, just move right here, you know, have the turning of the bone right here. So that's kind of a unique, interesting situation here. And it's important to understand when we talk about the pronator, the muscle that brings the palm down, because many of us, when we type, well, all of us, when we type, we have to have the palm down. And so that's why when people have some issues with wrists, like carpal tunnel syndrome, we try to figure out if the keyboard is a problem, to have one of those ergonomic keyboards I put in the ergonomic handout. But that goes all the way a little fast there. So as you're holding in, let's go to then the following next muscle stuff here. So we had the biceps brachii. We'll keep rolling here. We have underneath the biceps brachii, here's the biceps brachii, we have a brachialis muscle. And the brachialis muscle is attached to the shaft of the bone, like halfway down on the humerus, which, you know, is fairly far down. Then it goes into the ulna, and it flexes the elbow and it contracts. It's actually a thick muscle. So it doesn't do justice right here. It's actually, look at how thick it is. The biceps is just sort of on top of it and can show off. But the muscle that pushes the bicep upward is the brachialis muscle. And then when we go to the backside, we have a muscle in the backside of the, where is that one? The triceps. Here we go. We have a muscle in the backside of the arm, of the upper arm of the humerus, and that's the triceps brachii. And the triceps also has a little bit of attachments onto the shoulder blade. So it has a little bit of function on this joint and pulls the arm back a little in helping latissimus and other muscles. But the main function is done here in straightening out the elbow. You have this massive tendon going right into the tip of the elbow, the olecranon process. That's why we learned that. And that muscle is triceps, means three heads. So you kind of, in the front, you have the biceps, which is two heads, and the brachialis. And those muscles in the back make up the triceps brachii. And that's a really strong muscle. So it's really strong to push the arm down. And so that almost concludes all the muscles that we worry about in the arm. And what I want to point out to you is, like, they all have the word brachii in them. So when you see the word brachii, you want to understand you're in the arm area, in the humeral area. So we had that coracobrachialis and the biceps brachialis, and then the brachialis itself, the biceps brachii, the brachialis itself, and the triceps brachii. We have one more, and that one more is called brachioradialis. And that's kind of a goofball, because this is where we transition into the forearm. And the brachioradialis is attached up at the humerus, but at the distal part of the humerus. So that's why it's still called brachio, but it goes along the way, along the radius onto the radial styloid process, which is there on the thumb side. And so that muscle is interesting. So when you see them contracting, when you have a ball in your hand, you see how that muscle holds that wrist up in a flexed position and gives you more strength in that forearm. So that's a very important muscle. So if somebody has tennis elbow, that is the muscle that is usually in trouble. So that's why when you see people walk around with a wrist, with an elbow thing here, like the tennis thing where they have a dot where it pushes in right there on top of the elbow, that's what they're trying to do. They're trying to take some pressure off of this tendon here that is inflamed. So that's interesting there. So let's look at these muscles in the models. That way, oh, look at that, we're right there. So when we look at this, let's zoom out a little bit. So this is from the back. What I didn't show you before is the rotator cuff muscle that's on the underside of the shoulder blade. That's this one, that's the subscapularis here. But this is the triceps brachii in the back. So you can see, oh, here's the deltoid. Sorry, I'm not sure I mentioned that before. That's the deltoid. And then underneath it and going up into it, but all the way going down to the elbow on the back side is the triceps brachii. In the front side, you see this is the biceps brachii, and then this is the brachialis right here. And you can see the biceps brachii here is the most superficial one. You see there are two tendons down in here. If you actually, you can't really see that. A little bit maybe. And then underneath here, this is the brachialis right in here, right there. And as we take that, oh, and then what you see here, this is actually the coracoid process. So this sliver of bone going down there, right by the nerve there, that's the coracobrachialis. That's quite of a small muscle, but it's an important stabilizer. And so those are the arm muscles here, the brachii muscles. And then the last one we touched on is the brachioradialis. And that's probably, it's a little hard to see on this. So let's me. So you see here's the thumb. And then here's a muscle that goes, that's the highest muscle in the forearm basically, because what that does, it goes all the way up to about here, to about in here in the distal part of the humerus. And so that muscle here is the brachioradialis muscle. It's also, you can see it how it really follows from there all the way down to the thumb. And it's sort of the dividing line between the front arm muscles, the forearm muscles, and when you flip them up, the ones on the dorsal side, the ones on the back side of the forearm. Okay. Before I go into that, though, let me show you, I think we showed the pec. The pectoralis muscle is right here. You can see that on this model. And then the latissimus dorsi, I don't have a picture of the back side. You have to trust me on that. The video shows it. I'm sure the video shows what I need from there. But now let's go into the forearm muscles. And let me go back to the slideshow for that, because this is where you want to pay even more attention. I know, I'm sorry, it's a lot. But I'm I'm good, I'm glad I'm recording it. I don't want to have to do that without anybody listening. So when we look at the forearm muscles, here are the forearm muscles. This here, you see this here, this is the brachioradialis. This is on this side. This is the lateral epicondyle. Up in this area of the humerus, down on the bone, is the lateral side of the elbow, and here's the medial side of the elbow. You can see the medial epicondyle because that's kind of like just skin on bone, skin over bone, so it really hurts when you hit it. And I'm sure most of us have done that if we are alive. So when we look at the forearm muscles, we look at the ones in the front first, and they are all, as far as we are concerned, there's many layers, but we look at the top layer, and the top layer is all attached at the medial epicondyle. So we're looking at four muscles in the forearm, and the four muscles in the forearm are one that is right here that goes pretty much somewhat a little diagonal over towards the thumb. And then we got a few muscles that kind of go straight down the middle of the forearm right here. And the first one is a muscle that goes to the carpal bones, right in here. The carpal bones on the thumb side. And remember, the bone that runs on the thumb side is the radius. And so this muscle, what it does, it bends the wrist. And so that's flexion. So it flexes the wrist and it runs on the thumb side and it goes into the carpals. And so they call that bone, the muscle, the flexor carpi radialis muscle. Flexor for its function, for its motion, the action. Carpi, where it enters into, in the carpal bones of the wrist, and it runs on the radial side. And then we have the one muscle right next to it, parallel. And look at that muscle. That muscle goes all the way into the palm of the hand. So they call that muscle the Palmaris Longus because it goes into the palm of the hand. Some people, about 10% of people don't even have that muscle, and they still make you study it. Anyway, but then we have one more parallel on the outside, also kind of a sliver, and that's the, well, look at where that goes. That goes to the carpals here, and that's the pinky side, and that's where the ulnar runs, and so that's known as the flexor carpi ulnaris. Flexor of the carpals on the ulnar side. And then if we take those away, underneath it, we have Flexor Digitorum muscles and then pronator and a whole bunch of other ones that we're not going to worry about in this first looking at these muscles, because that's kind of a bunch of information there. When I studied that, we used to learn, when I studied that in chiropractic, they told us to learn these muscle names, like putting the hand, the part of the thumb, right into the medial epicondyl, and then laying the fingers under the forearm. And you can sort of have all the 4 fingers go in a direction where one of the muscles goes. So the pronator teres goes almost across, the flexor carpi radialis goes to the thumb, the palmaris longus goes into the palm of the hands, and the flexor carpi ulnaris goes to the pinky finger. And then we also learned to remember those. We use the first letter of each of them, and we call it PF, PF. The way we learned it, to remember which one is when and which, so the P and the F, they alternate, PF, PF. When I look at that on the model, these are the hardest. The legs, a little bit less hard. On the model, it's this side here. So the problem is, if you've noticed, the pictures and the models are a mirror image. And I have not found pictures that are not that way. And they're kind of, it's a little upsetting. I don't know why they need to do that. But anyway, you see here, that's why you have line marks. You have the thumb right here, and you have the medial epicondyle right here. This was the brachioradialis here on this side. You see that? That's that boundary between the front and the back side of the hand, or the forearm. And so you have the pronator teres going across here, fairly diagonal, into the brachioradialis. So you can see really where it goes. And then you have the next one, and that's the flexor carpi to the thumb side. So that's the radialis. And then next to it, you have the palmaris longus, and you see how that crosses over that white stuff here. And that's sort of an indication that the tendon goes over what's known as the flexor retinaculum, which is sort of a round sleeve that holds everything together. And it goes into the palm of the hand right in here. And then the last one that's next to that is right here next to it, right here. And that's the flexor carpi ulnaris, because it goes to the pinky side. All right, so that's the front of the forearm. And now we're going to go to the back side of the forearm. And we have a few muscles there. We have 3 of them. We're not going to be too crazy. That must just look like just a bunch of lines, huh? I know, I'm so sorry. This part is pretty intense if you do it this fast class. So when we do the test, you do the best you can, and we'll figure out how to work everything out at the end. But if you show me you're doing good work, which you are showing me for the majority of everybody, I am having no problem doing good work as well on your behalf and giving you, fair scoring and all that stuff. So when you do this test, I know it's tough and it's hard. I give you a lot of time to do it. So make sure of your resources, make sure you only use the term list to choose answers, and then we check on the other side. And also make sure that when you do this test, your score is probably going to be thinking it's damn low. I need to make sure I talk about that, because I just took a test myself. I'm taking an anatomy class too. I told you, right, to kind of get, an understanding of what other professors are doing. And on my lab, before he went in and started grading it, it was a 30 out of 50. And that was a 25 questions. So I missed somehow 10, 15 questions. And then he goes in and grades it. I don't know what I've gotten after that. Probably, hopefully a little better than that. I would think. But, make sure you don't freak out when you do these tests where you have to fill in words, because you have to type in the answers. And then I go in the background and I can give the program as many answers as I want as correct answers. But if it's a misspelling, for example, it's very difficult to catch all the different misspellings that students generally do. So I go in afterwards, and as the tests come in, I try to be fairly on top of grading them, and make sure, you don't have to have sleepless nights. So having said that, again, you take care of me by being participating in class, and I do everything I can to take care of you in that, all of that respect. So let's look back at this conundrum again, and this is the backside of the forearm. So we were just looking at the front part, palm here, and now we're flipping the arm around and looking at the backside. And in the backside, what we do, we look at muscles that are attached here on the thumb side, which is the lateral epicondyle, and then those muscles move downward. And as in the forearm, we have some that flex the wrist. In the backside, we have some that extend the wrist. And the word for wrist is carpi. And so we got two of them. We got one that is an extensor carpi on the pinky side, and they call that ulnaris. And then we got actually a couple, but we group it together as one. We got an extensor carpi on the thumb side, and we call that the extensor carpi radialis. See, we got a radialis longus and the brevis, but we don't worry about that. It's just one muscle. And I pointed out on the model. That way you see it. And then we have one muscle that's sort of kind of like the one in the front of the palm, the palmaris longus, but not quite, but it looks like it. And it's called the extensor digitorum. But you see the tendons go all the way to the fingers. And so as I want to get away from that picture, I want to get right into the model, because the model is what you have to actually identifying them on. And so when you look at the model, you see you have a bunch of muscles. You look at it here. And you see you have a muscle that's attached up here. That's the brachioradialis. And then you got a muscle here, there, and then there. And this is the extensor carpi radialis, longus and brevis, but I just tag it here somewhere, and that's the extensor carpi radialis. And then if you go to the next one medially, you see how that, you can see how that tendons, those tendons go into the fingers. And so that's the extensor digitorum. So make sure, some people make the mistake to go forearm on the front versus the back. So when you look at the forearm pictures, you look first, is it the front or the back? And then you look at where do the tendons go? Do they go to the thumb or to the pinky or into the palm? Or you can't even see it. And then on the back side here too, it goes towards the thumb side. And then it goes into the fingers, that's extensor digitorum. And then anything over here going to the pinky side, you don't have to worry if it's this or this or that, because we only tag one of them as testable. And so that will always be then the extensor carpi ulnaris on this side. Make sure also to understand and orient yourself that this here on top, the biggest top one, that is the boundary between the front and the back of the forearm, is the brachioradialis. That's, I think, the other thing that is often difficult to understand when you're in the midst of taking a test. And I know, unfortunately, this one you can't retake and retake, which is probably a good idea, because it's 55, it's 50 questions. I think it's 50 questions. I have to look, it's 50 or 55 questions, or 54 questions. Anywho, so that's what I have for the upper extremities. Now let's do the lower extremities. That's the last bunch, and then we'll do a practice test, which hopefully I give you a lot of goodies, and then we're gonna call it a night or an afternoon. So when we look at the back, at the thighs, at the legs, the lower extremities, we look again at different groups of muscles, and here we kind of look at functions of the muscles, and we have one group of muscles that are attached here at the sacrum and a little bit below, and you see them here, even the gluteus medius, and they reach around to the greater trochanter. And what they actually do is when they contract, is they turn that greater trochanter around, and that makes us bring the foot laterally and have the foot turn out. And so stand there with the foot turn out. That function is actually up in here. And so the one that I want you to know there, be able to label, is the piriformis. And you can see there is on the model also, there is a nerve, a yellow thing that comes down right underneath the piriformis, and that's the sciatic nerve. But the muscle right there is the piriformis muscle. So when you see it on the model, you see it. Oops. Oopsies. There we go. You can see it like right here. Oops. Right here, you see the nerve coming out, and then you see that muscle that sort of goes pretty diagonally a little backwards. That's the piriformis muscle. And then you see these muscles coming up here. These are actually then the gluteus medius muscles. And medius and minimus, they're kind of together, but I'm only asking you for medius and maximus. So when I look at the gluteus maximus, that muscle is this big muscle right in here, which is the butt area. And that goes down, that muscle goes down and anchors, a lot of it anchors into the iliotibial tract, which is this muscle. This white band here is the iliotibial tract. That's also on your list. And so the gluteus maximus feeds into the iliotibial tract from the back, and the tensor fascia lata, which is this muscle right in here in the front, feeds into the iliotibial tract in the front. So that's the tensor fascia lata. This would, in the old days, they called it the fascia lata, the white fascia. And that's why they made this muscle tensor fascia lata, because it tenses that fascia up. And so those are the muscles you need to know for this area. So it's the piriformis, the gluteus medius. You see actually a little medius here too. This is also medius. And then the gluteus maximus overlaying it. It's more superficial. And then in the front here is the tensor fascia lata. And then we have a muscle that's the razor of the thigh, and that muscle is known as the psoas muscle, and that's seen here, or iliopsoas. See that first, the second term is psoas/iliacus, and you see this muscle right here going up and down. That's the psoas muscle. So that muscle actually goes into the stomach area and is attached to the vertebra in the back end of things here, and then it reaches into the inner part of the thigh. And when that contracts, you can kind of visualize how when that shortens, it pulls the thigh upward, and so you're flexing it. So you're like, when you're sitting it, this muscle is always tight. So very often when people get like in a long car ride and then they get out of the car, they got to stretch out because they have a hard time stretching their trunk out. That's because this muscle's been tight for a long time. And when it's tight, it's shortened, it creates adhesions, and you got to stretch those out. So this is good to stretch those with doing lunges, if you like to stretch that. It's good to stretch that because it's usually a little tight on us sitting people. And then the one right next to it, right in here, that goes from the iliac fossa downwards to the inside of the thigh. That's the iliacus muscle. And so together, we call them often iliopsoas. And so I just put both names there, so you have both of those. All right, so that's that. And then when we go, let's just stay here. Is this all right doing these here on these models?
Yeah.
So, because you kind of have the booklet, and so if you actually stay with the models, it might be helpful for the test more. So then we get into the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius muscles. So those are the quadricep muscles that we have. And so this is the thigh. When we look at the thigh, we have the front of the thigh, the medial side of the thigh, and the back side of the thigh. We also have the lateral, but we just talked about that iliotibial tract. That's sort of because you don't really have more muscles more laterally that swing the leg outward. When you have muscles that do that, it's the glutes and the TFL that can do that, swinging the leg to the outside. That's why that's not really a motion we do that much, because it's also not easy to have muscles that are really well positioned to do that, because they would have to be out here and then bring the leg out that way. So that would be kind of weird. But anyway, if I were building a human, the quadricep muscles are the ones in the front of the thigh. And the one laying on top is the rectus femoris. So rectus means straight, and femoris means is the femur, so rectus femoris. And then we got this bulge coming out from on the inside. This is medial and also lateral. And that's the vastus medialis and the vastus lateralis. So you can see those on there. So if I tag them, I tag it right in here or right in here. or right on here. And then we get the, did I do the Sartorius? You don't have to know the Sartorius muscle. That's a mistake. Oh, no, you do. And then one muscle that's really kind of a goofball is this one that's going right on top here. Oh, by the way, this here is the TF elegans, the tensor fascia lata. So I showed it to you on the side, right in here. Here is the vision from the front, so you can see it. It's actually a muscle that's quite in the front. When you work it, it's right after that most tip part front of the hip bone, the ASIS. It's right next to it. So, but anyway, then we got this little sliver attached to up here, and then that goes to the inside part of the knee, right in here. And that muscle is known as the Sartorius muscle, because when it contracts, it guides. It's really guiding. It's a small muscle. It can't really have the full weight of the whole leg on it, but it guides the muscle in a motion that brings your leg to the opposite side, like brings your ankle to the opposite knee. And in old days, that's how people would be sewing. And so the Sartorius means actually tailor. So that's the tailor muscle. Tailor muscle. And then the vastus intermedius, I don't have a picture of. So let me show you on this part here. Come on. Poo poo. Kyle, I'm starting so much, my mouth's starting to hurt a lot, bit. All right, here we go. No, why not? Huh, what's wrong with me? Don't even have a picture of that? Well, if you take this away, if you take the rectus femoris away, underneath it on the bone, you have the vastus intermedius. Right here, you can see it's big bone. It's a big muscle. It's right, and it starts on the inside of the, underneath the rectus femoris. That's my word. Underneath is the word. So if you take this off, you see there is a muscle starting right here going down, and that's the vastus intermedius. I show it in the video, I'm sure, but it's not on the test. So just in case you're worried about it too much. There are all my little hints, so it pays off to listen to the recording. And then when we go to the back side of the thigh, right in here, we have what's known as the hamstring muscles. So those are in the back of the thigh, and they actually are attached to the sit bone and go to the medial and the lateral side of the back of the knee. And what they do is they flex the knee, they bend the knee at their main motion. And you got two of them that are on the inside. This is the outside, and so this must be the inside then. They go up and down here, and you have one on the outside. The one on the outside is known as the biceps femoris, and the one on the inside, the twos are known as, the top layer is known as the semitendinosus, and the bottom one is a little broader down in here. You see how it's more like a membrane versus a tendon. We visualize a tendon being round and the membrane being flat a little bit. So the bottom one is known as the semimembranosus. But if I tag it here, it's easier one of the two. You don't have to be, I'm not going to ding you if you give me the wrong semimembranosus or semitendinosus. Okay. Please forgive me. And then we have muscles on the inside of the thigh, and those are known as the adductor muscles. And the one that's really pronounced to be easily labeled is the gracilis right in here. That's the gracilis muscle. We also have the adductor magnus and adductor longus / brevis, and then the pectineus in there. But in all reality, what I really want you to know, because these are hard to differentiate, so I want you to know the gracilis, and let me make sure real quick something. And I think for this test, because it is very short of time studied, I think you cross out adductor magnus adductor longus brevis, and pectineus. I'm not going to test you these differences here. But the gracilis, leave the gracilis. That way. At least we're touching on the adductor muscles. So they're kind of cool. I worked on a football guy from Stanford, and he was really freaking good. And when I looked at his video, he would zigzag around. He was a short guy, but he's actually really good at the NFL now. And McCaffrey, and his adductor muscles were huge. They were so strong because the stabilizing, when you stabilize the thigh towards the inside, it's all these on the thigh, it's these inside muscles, and these are the adductor muscles that make sure you don't fall over to the outside. So it's kind of neat. That was really interesting to see that on an athlete, you know, that really makes those muscles really strong. I also worked on some gymnasts and some ladies that went to college with gymnast scholarships, and their upper muscles, they were so well defined. It's very, very interesting. Then you really can feel all these muscles we're talking about when you work on some serious athletes like that. Then I was on vacation, and they had college gymnastics going on, these teams against these colleges, and all of them. I see my patient on TV. It was really funny. It's like, oh, that's what she's doing. Anyway, having said that, we get to the last little bunch of muscles that we have, which are the ones in the leg. And when we talk about the lower extremities, the thighs are the upper parts of our, generally said, leg. So this is thigh. And technically speaking, only the lower part is the leg. And so we want to make sure, I want to make sure I tell you that. But when we get to the legs, we have a couple of muscles on the outside here. We have the gastrocnemius. That's a very pronounced muscle on the outside. And then underneath it, we have the soleus. You see that on the side. When we look at them alone here, this is the gastrocnemius on top. And you see the soleus here where it's attached, and then it goes together with the gastrocnemius into the heel bone, the calcaneus. And so that's a really, really powerful muscle, because when you contract that muscle, you pull the heel up. So if you stand on your tippy toes, that muscles, those two muscles are going to hold your whole body weight up. So they're really important. And that brings me to one more point. When you look at muscles in the lower extremities, you have some that are helping with gravity. They're anti-gravity muscles, which that means if you're standing up, you're pushing your weight up against gravity. And so you need to engage those muscles. And we got three groups of those. We got the glutes in the back of the butt. We got the quads in the front that straighten out the knee. And then we got the plantar flexors here that they call the gastric and the soleus, the triceps brachii. And that is the last of those anti-gravity muscles that keep us up. And that's why when we do the injury prevention seminar, or whatever, that handout that I created, squats are actually very important to test in people, because if people cannot push themselves out of a chair, well, you can kiss it goodbye. That's pretty much the end of the story. If they can't get up, the level of rate of you know, diminishing, increasing disability and all that kind of stuff, then death at some point, that goes way up when people can't push themselves up anymore. And so squats and activity is very, very important because of those things. And so anyway, those are the anti-gravity muscle. I think it's a question in the handout for the injury prevention. So I want you to know those two, and then let's just go through these. And then when we shave off that top layer of muscles, well, underneath behind the knee, we have one more, and that's the popliteus muscle. And, you know, let's just cut that out too for this exam. It's a cool muscle. It's a totally cool muscle. And there's a lot of unnoticed knee pain that comes with that muscle. That's kind of why I put it there, to have it for completeness. But you cross it out on the exam. That way we take at least a few things out. But then when we look at the deeper layer of the leg muscles, we look at a compartment in the front. We look at three compartments, one in the front, one on the outside, here outside, and then one in the back. And the back is right here. So the back one is behind, underneath the gastrocnemius and the soleus. Oh, see here, you see the popliteus too. And the muscle that we need to worry about for that is the tibialis posterior. And that's the muscle here in the back in the midline. We have in the back also muscles that flex, that push down. So that's plantar flexion. The digits, the toes, and the big toe. What's interesting about these is they cross over. Like this is the pinky side, this is the big toe side, and the hallicus, they cross. So I'm not worried about it because it gets too confusing. So underneath the gastroc and the soleus, you have one muscle in the back you need to know, and that's the tibialis posterior. If you turn it around to the front, you have a main muscle that you can touch right next to the shin bone on the outside, and that muscle is the tibialis anterior. You're also going to have, oh, look, and again, I saw it. I did not label these. For some reason, those labels I need to put in, but you see, one of them is the extensor digitorum, one is the extensor hallicus, and that means bring the toes up. Extending the toes is dorsiflexion in the foot, really. So they're a little confusing when they say extension. They really, in the foot, they call that dorsiflexion and plantar flexion. But if that was a little too confusing, don't sweat it. And then we have a compartment on the outside, and this is the fibula. This is all the fibula here. And so these muscles are right attached on the outside of the fibula. And look at the cool thing about these muscles is they go underneath the foot, right to here. And so if somebody twists an ankle, which many of us do or have done, that it pulls this muscle and elongates this muscle and flips it underneath. And that can make this muscle very, very sore. And so this is why I put a technique here. So this is the outside of the leg, and you can, I don't know if you want to use your elbow. So, but if somebody's really sore because they twisted their ankle, you can also take a thumb and move from the knee downward towards the outside of the heel. That's the medial malleolus. And so that's, I put that down because it's a good massage technique, because the stuff gets sore a lot. Just in case you're feeling frisky and you want to do that on somebody, on brother or sister or so, you want to abuse a little bit, or a parent maybe. So anyway, I think that's good for these. Let's look at the model real quick, and then we can catch a breath maybe. I need to catch a breath. So front on the outside of the leg here is the tibialis anterior. This is the back, the tibialis posterior. And I don't have a good picture of the fibularis, but it's right here on the outside. This is already gastrocnemius right here. From the outside, kind of like you can have the tip of the fibula here goes down, and that's the fibularis muscles. Oh yeah, these on the outside, they are the fibularis muscles. They're run by the fibular bone. So on the leg, besides the gastroc and the soleus, which I don't have a picture of, we have the tibialis anterior, tibialis posterior, and fibularis muscles that I want to worry about. All right, good. Now give me a life sign. Is everybody still around here, or you guys fall asleep on me?
I'm still here.
Are you?
Here.
Is your head exploding yet, or you're doing all right?
A little bit of both.
Okay, but you kind of got the gist of what I'm trying to say?
Yeah.
Good. Now you guys are great. I mean, this is, in class, I try to, if I have a whole semester, I think this is 3 days, 3 lectures, what we just did in like one. So feel good about yourself. You're doing Speedy Gonzalez. And so if you're actually picking up some of this stuff, and we can figure out how to make some of that stay in your noggin, we're doing really good. You're picking up a lot of good ideas for later studies. Yeah, make sure, Natalie, I had students that use the booklets to study for the nursing entrance exam.
Oh, okay.
Mhm.
Yeah, I'll definitely use this.
And I think it's because it's, we talked about before with all the, with all the textbooks and how much you have to get through unnecessary material. And I think it's because it's pretty much to the point. I might miss a few things here and there, but they seem to be successful with that. I even had some use it for the medical school entrance exam.
Yeah.
That's interesting. So I'm not going to complain about that.
I know. Yeah, and I will use all the help I can get because I know it's not going to be easy. But
you'll be fine. You'll be fine. Yeah, you'll be fine. Partly I come from test anxiety and in chiropractic, I was like, how am I going to get through chiropractic school with that? And I was also thinking I wasn't that smart. So
yeah, I'm the same way.
And so after, when I did my driver's license, I flunked the written test twice in Switzerland. If you flunk it 3 times, you have to go to the psychologist.
Oh.
And the first time I was sick for a whole week because the guy was such a jerk in front. So it's like, oh, I'm never going to do that. And so I got some of that. And then in Cairo school, at some point, it's just like, oh, it's just tests.
Yeah.
You're just getting used to the crap, right?
Yeah.
And so I think the faster you get into that process of understanding that, the better. But that's where something like this pre-chewed material is really good to study from.
Yeah. What was I say? Oh, Janka said something about a app. Let me see. The app is.
Did you find an app or you? Oh, I got a few texts. I did find an anatomy app that apparently is really good. Is that it's called? Oh crap.
No, this is an app for nursing school or to get in for the TEAS test.
Okay.
Oh, can you put it in the chat?
Yeah, it's just called nursing school. My friend told me about it.
Oh, cool. Yeah. That's also, that sort of helps you with getting in terms of the test.
Yeah, you can pay to take a whole bunch of tests, or you can do timed tests. I just do the free version, but it has English, science, and math, and it's just free questions, and they have a daily question you can answer too.
Oh, nice.
That's good. That gets you in the zone too that way.
Yeah, and it keeps you kind of on track to study.
Yeah.
Yeah, exactly. And is it expensive if you pay for it? Did you check or not?
I didn't check because the free version's pretty good. I mean, if you want to pay for it, you'll just be paying to look at old questions that you have already answered, and they kind of tell you why that's the correct answer.
Okay. Is it on the App Store?
Yeah.
Is it this
one? Let me see. Yeah.
Yeah, it is this one?
Yeah.
Okay. I was like, this is the one that popped up, but it's not, it wasn't called that.
That's perfect. Yeah, that's we gotta remember these apps are actually really good too.
What anatomy app are you talking about?
Yeah, the one that I think is good that some students are using, and I just downloaded it. I haven't really used it much. It's called Complete Anatomy. Let me write it down in the text. Complete Anatomy 21, -21, for 2021.
Okay.
And that she said the student who told me about it said it's good. It's a good free version. I'm actually even thinking of maybe paying for it.
Is it this one? Hold on.
Go a little bit towards you. I can't see it. Yes.
Okay.
And so that's from Elsevier. So that's actually a really good publisher. So I think those might be interesting to study from too. And make sure it's not stuff is not too complex. That's the other side of it, that we get lost in the details a little bit. That sometimes.
Yeah, I was looking at some on Quizlet, and it was kind of confusing because they went into detail on some of them, and I was like, I haven't learned that.
Yeah, you need, and depends. I mean, the anatomy class I take, which is interesting, is in a muscle. It's a higher level class theoretically, but it doesn't go as much detail that we're covering. And so and then it goes a little bit more detail in tissues. But so it also depends on the instructor to some level of how detailed we go with which stuff. And so be careful not to overextend or waste time in some ways, that way. That's also the cool part about the flashcard. I don't know if you guys have been using flashcards for the first test, but the flashcard system, the way I outline it in that little pamphlet I gave you with the boxes, if you haven't read through that, make sure you read through that, because that's a good way to organize your studies. I used that system all the way through Chiro school. It kept my brain from being too overwhelmed, because you take some time to make the flashcards, but once you made them, then you have a system of not studying stuff you already know over and over again. And so I think, so make sure you look at that, particularly as we then move towards the last part of the class, when we get into the heart and we get the blood and so forth, because when it gets to that, and let me actually go a little bit ahead and show you for that last part, because you're gonna be doing some work already probably before we meet again. If you go to, you see my Zoom, if you go to module, the last one, give me some modules, there it is. The last one is the test 3. So that's all the way in another while. But when you finish the test for the test term list 1, and you put that material to the side, we won't talk about that anymore. So then you give yourself a day or so and give a breather, and then you go to the next part, which is the last part of the class. And in there, we have under test 3 review, I have a review that talks about all the points that I want you to know for the final test as it comes to the physiology part. The third test has components from the first test and from the second test. So some of it is anatomy, which we have a term list 2 for, but some of it is physiology, and like the first test where I ask you these multiple choice questions. And all the things I asked you there are on this review sheet. It's a 4-page sheet. And so you want to print that out when you study the next chapters after the muscles and the bones, because these bullet points are the things that are going to be on the test. That these are the ones, the specific points that I want you to remember for the exam. The other part of the class, as it comes to the physiology portion, this is an anatomy class, but we still want to talk about, some stuff is woven in with a little bit of what does a monocyte do and so forth. That way we have conceptual understanding of it. And those questions are all on this review. So you want to get through the next videos and do the quizzes, but keep in mind, once you understand that material, all you need to remember for the test are these points. I know that was a little winded, but that makes sense?
Yeah, thank you for that, because I looked over the next 3 weeks and each week is a booklet.
Oh, it's heavy. Yeah, it's heavy.
Yeah.
It's very, it's a 9-week class. So you guys are definitely, jumping into cold water here in terms of studying, but that's why we want to have it as well organized as possible. And so that's how we can do that. It reminds me, because these bullet points are actually great for making flashcards. You got the information already pre-chewed. And maybe 1 or 2 points don't really make that much sense. But, that's the stuff we're going to talk about then as we get through next week's. You got it?
And I also just want to say, for this being a fast track class, you do a really good job at teaching it, because you don't make it too extremely heavy, but you make it to where we're learning what we need to be learning in a good amount of time.
Oh, good.
I agree with that.
Oh, good. So it is manageable. And so, it's a lot, but you can tolerate it. Okay.
I enjoy it a lot, actually. I don't dread my homework.
Oh, good. Well, that's actually the whole point. Because school was always a hard thing for me. And when I went through this stuff myself, and when I then went to Chiro school, because they told me I have good hands and I should develop those skills. And so I did, and then I went back, and then I realized I learned so many things. But one of my kids has a learning processing problem, an auditory processing problem, and they can't process from words to pictures easy. And so then she went to a massage school, and I worked with them about learning this anatomy stuff. And so that's how these booklets got created, sort of. So that's why it's a lot of pictures. And so that's good. So it's, yeah, well, spread the word around. I need to make sure, you know, I teach as many people as possible. It's my job to do that, my mission.
I definitely recommend you to everybody.
Oh, good. Well,
Yeah.
you know, because if you know some of this stuff, you can make better decisions about your life. You know, it's like, it's very important, I think. And yeah, I'm trying to figure out how to get Merced on Rate My Professor. So by the end of the semester, hopefully I can ask you to write these things. So then I can go to Dean's like, you got to keep me. Because this is my first semester at Merced.
Oh,
And so
okay.
we'll see what, I've been teaching at Merit for 15, 20 years. Time goes really fast when you're having fun. And I'm enjoying it, of course. But anyway, let's do a little quiz. So I want to make sure last week's quiz, you keep those answers with you. Those are some of the answers in there are the ones that are on the test. So I'm trying to guide you a little bit, okay? And it's going to be the same with this week's. So I want you, I want you to take a sheet of paper, and we do about 10 different muscles that I'm going to ask you from the models. All right, so let me share this with you again. And so I want you to tell me okay. Let me find my way around what I'm doing here. What am I doing? What am I doing? Come on. So the first muscle I want you to tell me is here in the trunk. It's the one that's, and don't tell me, write it down. It's the one that goes from the spine down to the inner thigh. And then it also has a part that comes from the iliac fossa down to the inner thigh as well. And it raises up the leg, or the thigh, sorry. So you just write it down. And then let's see, do I have more here? And then we get to the arm here, and I want you to tell me the muscle on the arm that is this one here, that's on the outside of the shoulder. It's on the shoulder, the outside of the shoulder muscle. That's number 2. We're going to stay right here. Number 3, I'm going to ask you the muscle that's on top here of the shoulder, that's above the spine of the scapula in this fossa here. What's that muscle called? And then I'm going to go right to brutality here. Actually, not quite. First, we do one muscle up here in the arm. And I want you to tell me, when I look at the front here, so this is the front part of the arm, and that's the humeral part, the humerus area. And this top layer muscle, I'm going to take that off, and I want you to tell me the one that lies underneath. So it's not this one on top, that's two-headed, it's the one underneath it. And it's number 4. The one underneath it. And then from there, we go to number 5, and that we move right into the forearm, because this is probably the trickiest part of the situation here, is the forearm. So on the forearm, I want you to tell me the muscle that actually starts up in the humerus and goes downward towards the thumb side. And it's sort of the dividing muscle between the front and the back side of the forearm. So it's a muscle that kind of from its name belongs to the upper arm part, okay? What muscle is that? That's number 5. You guys are good. This stuff is hard. So just hang in there and absorb as much as you can. Then I got another one in the front here, and that muscle, so all the front muscles are attached to the medial epicondyle. And this one is the first one that goes right across, and you can't really see where it goes. It goes underneath. So that's number 6. Number 6 is this one that kind of goes diagonal here. And then number 7, we're going to go to the back side of the hand, of the forearm. And I want you to tell me the muscle that's not the divider that we just already had, the one that's next to it and a little bit down here, and it goes towards the thumb side and anchors into the carpal bones. On the thumb side. Remember the bone that goes on the thumb side. It's number 7. Good. And from there, we're going to go to the lower part here. And I would like for you to tell me a muscle that goes across on the hip, right by the nerve. And it's the one of them that turns the foot outward. So it goes here right at the nerve. Number 8. Number 8. Oh, look at that. Number 9. Is, what's this muscle called here in the back of the thigh? Muscle in the back of the thigh on the inside, the medial side. Muscle on the back of the thigh on the medial side. And then lastly, I would like for you to tell me which, wait. I have one more, and that's the muscle. Right here is this, that crosses over the front, the top of the front on the thigh here, right here, crosses over. The talar muscle. The talar muscle. Good. All right. That's good enough. You know, it's funny when we talk about, you know, making things accessible and not too difficult. You guys remember, well, you don't remember, I don't remember, but John F. Kennedy was the president who got shot in the 60s, right? And he was really injured and had a bad back. And his doctor was Janet Travell, was her name. And she worked with muscles, injecting muscles, because that's what helped his back the most. And she became the first and only woman, female surgeon general in America in the 60s. And she wrote a book about muscles, and she describes every muscle becomes a name and has a name. So the trapezius in her world is the coat hanger muscle, for example, because if you have a coat that pushes down on the shoulder, that usually activates that muscle and creates pain patterns and headaches and stuff. And so it's interesting to read it because it's very dense material, but you know, even somebody like her tries to make it more understandable for even the practitioners that learn it and not more complicated. So that's kind of, you know, to me, that's always interesting. Anyway, let's go through them. What's number 1? Did you guys, anybody figure that out? Speak up. No?
I didn't.
Yeah, I know. These are tough.
Oh, wait. Is it the piriformis?
No, that is number 8.
Oh.
So now that's good though, because the front, the one I checked is in the front. So that's the psoas and the iliacus going up and down in the front of the gut. So that's inside on the gut. The piriformis, we can jump down here real quick. That's the number 8, right here where the nerve comes out.
Oh, okay.
So that's in the back. Yeah, don't feel bad. I wouldn't be able to answer these necessarily either right on the spot after we just learned them. So do not feel bad. It's a discussion, okay? And keep sharing. So that's the piriformis. Then number 2, I pointed to this muscle here. Any of you remember that?
Is it the deltoid?
It is the deltoid. Good job. That's the deltoid. When you look here, you can see it a little bit goes out, and then on top, and so it looks like an inverted triangle. That's a delta. That's that's where the term comes from. And then we're gonna be on top here. What's that on top called? Anybody?
Trapezius?
Almost. Trapezius starts from here and goes upward. This is the supraspinatus. So we have the one, if you look at the muscles on the shoulder blade, you're looking at the supraspinatus, the infraspinatus, teres minor, teres major, and subscapularis right in here. So you look at those, when you look at the list, it's those rotator cuff muscles. Good, though. That's then the next one is in the arm. And it's the one where we take the biceps brachii away. What's underneath it?
This one I had no idea.
It's the brachialis muscle. Brachialis. So you know the biceps brachii is on top, and then you have a few left. When you look at the word brachia, you have a muscle here, you're thinking brachia something. So you have the brachialis is one of them. You have the coracobrachialis that's from this point up here in the right by the clavicle kind of. And then in the back you have the triceps brachii. And then when we go forward, we have one more brachia muscle, and that's number 5. That's right here on top, laying here, dividing the front from the back part of the forearm. What's that one called? Anybody? Hard one.
I don't think I can say it.
Good, try it. Come on.
The brachial radius.
Yes, brachioradialis. Super. Brachioradialis. See, that wasn't too bad. That's a tough one. So that one is good to remember. And then when we were right there, I asked you for number 7. I asked you the one kind of next to it that is on the back side of the forearm. That's number 7 and goes to the thumb side of the carpals. Anybody caught that?
Extensor carpii radialis.
Super. That is really good. That is a tough one. So when you look at this muscle, if it's hard to figure out, you go, is this the back side of the forearm or the front side of the forearm? If it's the back side of the forearm, which this is, you're going to look at the muscle here. Where does it go? Oh, it goes to the, it's kind of hard to see where it goes, but it goes to the carpals. And then you look at which side is it? Oh, it's the thumb side. So then you know it's the back side of the hand. That creates extension of the carpals. And it's on the thumb side, and that's the radialis is on the thumb side. The radius runs there. So that was very, very good. And then I have one more here in the forearm, and that's one that is in the front side and goes across from the medial epicondyle and sort of disappears here. Anybody had that? No? Yeah?
Is it pronator teres?
Yes, it's the pronator teres. That's fantastic. That's a tough one too. Make sure you know, keep that list handy, okay? Hint, hint.
Wait, what number was that?
Numbers 6.
Okay.
And then number 9, we did number 8. That was piriformis right here. Number 9 is a hamstring muscle in the back of the thigh, the one that's medial, going to the inside part. Anybody got that one?
I put bicep femoris or something like that.
Almost. That's the one on the outside. And the one on the inside is the semitendinosus and semimembranosus. But that's a small little mistake. I'm have to figure out how to do that, because that's really close. That's really good. And then the last one that I did is the one that lays on top of the front of the thigh and goes across. Anybody have figured that? That's the talar muscle. You can see it right here too.
Is it serratus?
Almost. Sartorius.
Oh.
Sartorius. The serratus is the one in the trunk by the ribs that comes out on the side of the ribs, but it's a very similar name, so that's good. So what I think, so that was good, you guys. I know that's, you guys all right with these? Did these make some more sense as we go through them?
Yeah, I just want to say something though. When it's like a picture of a body part and we have to name it, like if it's really zoomed in on the body part, I can't tell what it is. Like if it's part of the arm or if it's part of the leg or if it's part of the foot, just because it's so zoomed in, I don't know what it is, you know, and it makes it hard.
Yeah, let me show you, because that's one of the reasons why I'm making videos. And so let me show you on a question here. Let me find a muscle. It's probably mostly with the muscles. Let me find a muscle question. Where is it? Look, you get one more freebie here. Ooh. I tried to be not too close up. So this is going to take a little while. I got to get to the bottom here. Landmark, no, I want muscle. Good, let's just do this, okay? So you see the picture? You see it?
Mm-hmm.
And then if you take a little more time, it will show a video.
Okay, I didn't know there was going to be videos too.
Yeah, I know. I try to make it as that way as understandable as possible. And it's still, I think it's as clear as I'm going to get it.
Mm-hmm.
At least most of them.
Thank you. I appreciate that.
See, like there, you can see the video. And so then if it comes on, it's like 13 seconds. It's not long, but I talk about it a little bit. My poor computer is overworking. Oh boy. Come here. There he comes. 37. We take the front off. It's a muscle underneath in the front. 30. You see that?
Yeah.
Does that help it a little bit?
Yeah.
Make you feel better a little bit?
Yeah.
No, I know. This is you know, you just gotta plunge in and study some more. I think what I would do is watch the review videos that I made a couple times, maybe with the term list, and then have the pictures maybe printed. I don't know if you can print out the pictures I made and label those. That would be an exercise that might help even more, because I use those models, right? And if you know, and then I would just dive into it. But those are sort of the preparation I think I would do. I wouldn't worry at this stage, if you finish the homework, I wouldn't worry about filling out all the action and all the label, you know, all that stuff. I would go right to the meat, what I want from you. And that's why I would watch those videos passively. You can watch them on the phone, you know, if you got Canvas on the phone, or figure out which videos they're on YouTube. I have I think they're on the lab somewhere on my YouTube channel as well. But Canvas has an app for the phone. I don't know if you guys use that. because that's pretty convenient. I use that. And so that's what I would do. Watch those videos, make sure you look at those models on the paper, and then go for it. And be clear, I'm not going to ask you anything that's not on the list. So don't go scrambling and like, oh my God, this looks, be focused like in the forearm muscles. Try to be systematic how I explain it to you. Maybe watch this video one more time. Okay.
Is it going to be all this stuff under muscles?
Well, it's the term list 1.
Huh?
It's the term list 1.
And then so like there's muscles right here. It says muscles.
It's muscles, but it's also the stuff on the other side.
And then everything under there.
Also the bone.
Okay. Oh, okay.
Yeah, it's the whole term.
I don't like muscles. Like I think this is the hardest part of this class is the muscles, because the names of the muscles are so long. I can't pronounce any of them, and it makes it harder to remember things when you can't even pronounce them,
I know. That's why I'm trying to make you guys vocalize them. When it's a slower class, I make the whole class say the muscles in together. That we can slowly learn how to pronounce those things. Absolutely. But, this is the first rodeo through them. So, it took me many times going through them to really know that they're sticking in my head. And so don't be too tough on yourself. Do study hard, do the best you can, go through those steps that I just told you, focus on the videos, on the meat and potatoes, not on extra stuff. And then, do it and give the best you can. And we'll figure it out at the back end. Believe me, I'm not going to drop you guys because, it's a little hard to test. It's not that easy. The stuff is not that easy, but we can do it together. All right. It'll be cool. And then, if you're freaking out, shoot me a text. Can you grade my test? I just did it. I need to know what's going on. And so I do the best I can.
Okay.
All right. All right, good. Okay, guys, any last questions that you guys have?
No.
With that, I wish you good luck then. All right.
Thank you.
Do the best you can. Hey, I had to do a 150 question test on Monday. I was so fried afterwards. So I'm trying to go through the same thing as well. So you're not the only one. All right.
We can all go through it together.
That's right. Okay. Take care, you guys.
Have a
Bye.
good
Thank you.
Have a good one. Bye.
See you next week.
See you next week.